Welcome back. We are going to be moving on to more medical technology. Biotelemetry. This term might sound high tech, but you've likely already used or seen it in action. Bio means life, and telemetry means measuring data and transmitting it remotely. So, biotelemetry in EMS is the capability to measure a patient's vital signs, biological data, and send that information to another location, like a hospital, in real time. The classic example of this is transmitting an ECG, electrocardiogram, from the field to the hospital. Biotelemetry measures and transmits vital signs and is mostly used with ECGs, enabling early diagnosis and treatment of ST elevation myocardial infarctions. Let's unpack that. When a paramedic records a 12 lead ECG on a patient with chest pain, modern cardiac monitors can send that ECG tracing to the hospital, often to the emergency department or directly to a cardiologist's smartphone. This might be done over radio frequencies, an older method, or more commonly now via cellular data. By receiving the ECG while the patient is still en route, the ED can confirm the findings and activate the cath lab early. Studies have shown that this kind of telemetry significantly reduces the time to treatment. For instance, shaving precious minutes off the door to balloon time for a cardiac patient. Early activation means when you roll in with the patient, the cardiology team is already assembled and ready to go, rather than first evaluating the ECG on arrival. This saves heart muscle and lives. Biotelemetry isn't limited to ECGs, though that's been the most common use historically. We can transmit blood pressure, pulse oximetry, respiratory rate, or any data our devices gather if the system is set up for it. In some advanced systems, even things like ultrasound images or videos could be transmitted, but typically the bandwidth and need focus on ECG for now. The slide also mentions two-way data transmission. This implies that data isn't just one directional, field to hospital. There can be an exchange. For example, some systems allow the hospital to send a confirmation back, ECG received, or even send back advice or settings, though usually voice communication handles advice. In the future, two-way telemetry could mean the hospital might adjust something on the monitor or request a different lead view remotely, etc. At the very least, a two-way capable system ensures you know your data got through, acknowledgement, which is important. For now, as new EMS personnel, remember that biotelemetry equals sending patient data electronically from the field. The most likely encounter you'll have with it is if you work with paramedics who can send 12 lead ECGs to the hospital. If you're on such a call, you might hear the medic say, "I'm transmitting the 12 lead now." As EMS personnel, your role could be to relay information over the radio in parallel or ensure the patient info, name, etc., is attached to that transmission. It's also good to know how the equipment in your ambulance works. Some monitors send automatically via a built in cellular modem, others might use a connected tablet or even the radio's data channel. Advances in pre-hospital ECG telemetry have indeed led to dramatically improved outcomes for heart attack patients by enabling early diagnosis and treatment. It's one of the triumphs of EMS communications tech. And as technology marches on, expect biotelemetry to expand, perhaps more telemedicine consults in ambulances, more data sharing, like transmitting electronic patient care reports to the ER before you arrive. All of that falls under this concept. It's an exciting area where communications and medicine intersect to improve care. Now we shift from technology to technique, communicating by radio effectively. The slide reminds us that the effectiveness of radio communication depends on two broad factors: the technical hardware and software, and the people who use it. We've covered the hardware side: radios, repeaters, networks, etc. But even the best equipment won't fix communication problems if we, the users, don't operate them correctly. Let's talk about the human factors in radio communication. Using a radio in EMS is a skill. In the chaos of emergencies, it's easy to fumble it. Here are some best practices and considerations. Familiarity with equipment. First, know your radio. Know how to turn up the volume, change the channel, press the push to talk, PTT, properly. And if there are emergency alarm features or different zones, know those too. A surprising number of issues come from user error, e.g., accidentally bumping the dial to the wrong channel and suddenly you're calling into the void. Make it routine to check your radio at the start of shifts. Ensure it's on the right channel, battery charged, etc. Audio technique. When you key the mic, hold it about 2 inches from your mouth and speak clearly and calmly. In a stressful moment, people tend to either yell or talk too fast. Take a breath, speak in a normal volume, and articulate. Also, pause for half a second after keying the mic before you start talking. Many radio systems have a slight key up time, and if you start speaking immediately, the first word or two can get cut off. Avoiding radio traffic jams. Only one unit can talk on a channel at a time. On a simplex channel or even on a repeater channel, only one voice goes through at once. If two people transmit together, it garbles and no one is understood. So listen before you speak. Make sure the channel is clear, or if someone else is talking, wait your turn unless it's an emergency you have to break in for. On a busy night, dispatch might be juggling multiple units. Be patient and professional, even if you have to wait a moment to get your turn. Human factors, stress, and clarity. People who use the radio matter because our communication style can affect the message. If you're excited, scared, or in a rush, it can reflect in your voice and words. A frantic tone can actually make the listener, like the hospital or dispatch, catch your anxiety or misunderstand you. So, as EMS personnel, one of the arts you'll learn is sounding calm on the radio even when things are chaotic around you. This is not just for show. A clear, calm voice is easier to comprehend. Team coordination. Within your team, decide who will handle the radio at a given time. Often, one provider is focused on patient care while another handles communications. If you're the one with the radio, pay attention to it. Conversely, if your partner is on the radio, try not to make them talk to two people at once, you and dispatch. Coordinate so important messages aren't missed. Ultimately, good radio communication is a mix of good technology, working radios, strong signals, and skilled people, disciplined users. We have the hardware part largely handled by our system design. The human part is up to us. Practice. Listen to experienced medics handle the radio. You'll notice they often use a calm, concise manner regardless of the situation. You've heard FCC mentioned a few times. Let's clarify what the Federal Communications Commission, FCC regulations mean for EMS. The FCC is the U.S. agency that oversees all non federal communications, including radio, TV, and public safety radio systems. They have several key roles and rules that impact how we operate our EMS radios. Licensing. The FCC issues radio licenses. Every ambulance service or public safety agency must be licensed to use specific frequencies. You, as an individual provider, don't need your own license. You operate under the agency's license. But your agency can't just pick any random channel and start talking. It must be authorized by the FCC. Licenses ensure that frequencies are assigned in an organized way and that one agency's transmissions won't interfere with another's. Allocating frequencies. The FCC allocates blocks of the spectrum for certain purposes. For instance, there are portions of VHF and UHF specifically allocated to public safety. The FCC decided which part of the spectrum EMS, police, fire, etc. can use nationally. Allocation prevents, say, a taxi company from broadcasting on an EMS hospital channel or vice versa. Technical standards. The FCC develops technical requirements for radio equipment. This includes things like signal modulation standards and bandwidth. They also approve radio hardware to make sure it meets these standards. For EMS folks, one notable standard is that since 2013, all VHF/UHF radios had to be improved. Agencies had to upgrade older radios. If your service has modern radios, they're compliant. If not, they wouldn't be allowed to transmit legally. Rules and regulations for operation. The FCC has rules for how radios should be used. For example, transmissions should be brief and necessary for public safety. No chit chat or non essential use on emergency channels. It prohibits obscene language on the air. It also mandates identifying the station. You might hear dispatch identify with a call sign occasionally, less so now with modern trunk systems that do it automatically. But on some channels, an EMS unit or base might say a call sign to identify themselves at certain times. The point is, using the radio comes with legal responsibilities. In EMS, we usually adhere to these without thinking because they align with professional conduct, but it's backed by law. Monitoring and enforcement. The FCC monitors transmissions and can enforce rules. If someone is misusing the radio, for example, an unauthorized person hopping on an EMS frequency or an EMS provider transmitting inappropriate content, the FCC can track it down. They have radio direction finding trucks and personnel who investigate interference or misuse complaints. The penalties can be steep fines or loss of license for the agency. So, what does this mean for you in practical terms? Follow your communication protocols and keep it professional. Don't use the EMS radio for personal messages. Hey Bob, what's for dinner? Is a no go. Don't give out confidential info. As we'll cover next, that's also an FCC thing. Patient privacy pertains to content rules. And treat the radio like an official channel that is being heard and possibly recorded, because it is. We've talked about how to communicate, technology and technique. Now let's talk about what and how much to communicate. Essentially, the clarity and content of your radio transmissions. Good communication isn't just getting a signal through, it's making sure the message is understood correctly. Several guidelines for clear, effective transmission include the following: be accurate and concise, say what is necessary and no more, but make sure what you say is correct. On the radio, especially in EMS, time is of the essence and channels can be busy. Plan out your message in your head if possible before keying the mic so you don't ramble. Include key pertinent facts and leave out fluff. Concise doesn't mean leaving out important info, it means efficient. For example, instead of narrating, so, we found this guy and he's in a lot of pain. I mean, he's really not feeling well. We think it might be his heart. You'd be concise. We have a 50-year-old male with severe chest pain, possible cardiac issue. Protect the patient's privacy at all times. This is crucial. Radios are not secure. Anyone with a scanner could potentially listen in. Plus, patient information deserves confidentiality. That means do not transmit identifying information like the patient's full name or exact address over an open radio, unless absolutely necessary for some reason. Usually, you'll refer to patients by general descriptors: an adult male patient, or a 6-year-old female, or perhaps the location, the patient from the car accident on I-90. Never say, John Doe at 123 Main Street is feeling ill over the radio. Also, avoid details that aren't relevant to immediate care and could embarrass the patient if overheard. Privacy protection aligns with HIPAA laws as well. Be impersonal in your language. This means keep communications professional and objective. Use third person, the patient, rather than first names or nicknames. Also, avoid emotionally charged or slang expressions. You're not going to say our poor guy is in really bad shape over the radio. Instead, the patient is critical, vital signs are. Being impersonal also means no personal opinions or unrelated commentary. Stick to patient care information or necessary operational information. Use proper medical terminology. When communicating with other medical professionals, like medical control or the receiving hospital, speak the common medical language we're trained in. That means using terms like abdominal pain instead of tummy ache, altered level of consciousness instead of acting crazy, cyanotic instead of blue, etc., as appropriate. Proper terminology conveys precise meaning. Act professionally. This is a catch all for demeanor on the air. Remember, every transmission is effectively a recorded public record of how you conduct yourself. Always remain calm, polite, and direct. Use please and thank you when appropriate. Though brevity is key, you can say copy thank you to dispatch. Don't argue or express anger over the air. If there's frustration, like you can't find an address or you think dispatch gave a wrong location, handle it professionally. Question orders or information you did not hear clearly or don't understand. This is so important for patient safety. If a doctor or dispatch gives you an order and you think they said something but you're not 100% sure, ask for clarification. Say, command, repeat last order, or hospital, please verify medication name, transmission was unclear. Never blindly act on something you only half heard. Radios can crackle, words can be lost. It is always okay to ask for a repeat. It's better to take an extra 5 seconds to verify than to administer a wrong drug dose because you misheard. Also, if you receive an order that you did hear correctly, but it doesn't make sense to you, maybe a dosage or procedure that seems off, you can echo it back to confirm. Just to confirm, you want 5050 of Benadryl, correct? That technique of repeating back critical info is taught in crew resource management to catch errors. Our final topic is about using codes in communication, or rather, the trend away from using codes in EMS. Historically, public safety communications were filled with coded language. You're probably familiar with police 10 codes, like 10-4 for acknowledgement. EMS had its share of codes too, and different regions developed their own numeric or color codes for various emergencies. However, most EMS systems today have phased out the 10 code system and other radio codes in favor of plain language. Why the change? Because codes can cause confusion, especially when multiple agencies work together. One department's code 10 might mean something entirely different to another's. Even something as simple as 10 to 13 could lead to a misunderstanding if police and EMS use the same code number for different meanings. In emergencies that require interoperability, remember that word, using codes can be a barrier. The National Incident Management System actually discourages the use of radio codes and mandates plain language during multi agency responses. FEMA has stated that plain language is essential for clarity and that in any joint operation or disaster, responders should speak in clear terms everyone understands. Think of it this way: during a big incident, you may have units from across the country assisting. The only language guaranteed to be understood by all is plain English, not a local code. The slide also mentions the Medical Priority Dispatch System and its specific format for indicating the nature of emergencies and priority. MPDS is used by many 911 centers for call triage. You might have heard of codes like Echo Response or Delta Response. For example, a dispatch might say, "Responding units be advised, this is a Delta level response for chest pain," which tells experienced providers that it's a high priority call. Delta often means life threatening, but not absolutely immediate like echo. The key is that MPDS codes are standardized, the same everywhere, so they are not like local cryptic codes. They're more like a medical shorthand that all who use MPDS understand. Even so, when communicating over the radio, dispatch will usually include a plain language description with any code. Category echo, cardiac arrest, for instance, to be absolutely clear. So, what should you do? Use plain everyday language for communication. Instead of saying 1076, if that meant en route in some system, just say en route to hospital. In training, some of you might learn old 10 codes or hear them from senior folks out of habit, but be aware of your local policy. Chances are it requires plain speech. NIMS compliance, which all agencies must adhere to for federal funding, requires plain language for interagency communications and strongly encourages it day to day. One interesting note: even though we've moved away from codes, some acronyms or abbreviations are still used, but those tend to be widely understood like MVC for motor vehicle collision or ETA for estimated time of arrival. Those are generally fine if they're standard in your region. When in doubt, opt for clarity. We've covered a lot of ground, from the nuts and bolts of radios and frequencies to high tech tools and the art of clear communication. The big takeaway is that communication is as critical as any medical procedure we perform. It links everything together. As new EMS personnel, investing time in mastering your communication skills and understanding your comms equipment will pay off every day on the job. Technology will keep evolving. Who knows? In a few years, we might routinely use video calls from ambulances or new satellite data links, but the fundamentals of clear, concise, and effective communication will remain the same. Keep these principles in mind, and you'll ensure that no matter how chaotic the scene, the right information gets to the right people at the right time. Thank you for listening, and stay safe out there, communicators.